Question 1. Mr. Davis is preparing to perform a routine nuclear medicine scan on a patient who has recently undergone iodine-131 therapy for thyroid cancer. The procedure involves the use of a gamma camera and the potential exposure to ionizing radiation. What is the most appropriate approach to ensure radiation safety in this scenario? A. Increase the patient's exposure time to allow for higher quality imaging. B. Ensure that shielding is used around both the patient and the healthcare provider. C. Have the patient move as much as possible during the procedure to reduce exposure. D. Instruct the patient to remain in the scanning position for the shortest time possible without considering other factors. Answer. Correct answer. B. Ensure that shielding is used around both the patient and the healthcare provider. Explanation. In nuclear medicine, radiation safety is crucial to minimizing radiation exposure to both patients and healthcare workers. The ALARA principle, as low as reasonably achievable, emphasizes minimizing exposure by reducing time, increasing distance, and using shielding. Shielding is one of the most effective ways to protect both the patient and staff from unnecessary radiation exposure. This is particularly important for therapeutic procedures like iodine-131 therapy, where the patient might still be emitting radiation post-treatment. Properly used shielding reduces the risk of unnecessary exposure. Increasing the exposure time or not considering shielding compromises safety standards set out in radiation safety guidelines, e.g., Health Canada's radiation regulations under the Atomic Energy Control Board. Question 2. Considering the challenges involved in the preparation and handling of radiopharmaceuticals, which of the following is true regarding their quality control? A. The radiochemical purity of a radiopharmaceutical is unrelated to its effectiveness in the diagnosis. B. Sterility of radiopharmaceuticals is only required when injecting intravenously. C. Radionuclide purity is the main criterion for assessing the therapeutic effect of the radiopharmaceutical. D. The quality control process ensures that the radiopharmaceutical meets all regulatory standards before being used clinically. Answer. Correct answer. D. The quality control process ensures that the radiopharmaceutical meets all regulatory standards before being used clinically. Explanation. Quality control of radiopharmaceuticals is essential to ensure the safety and effectiveness of nuclear medicine procedures. This involves evaluating parameters such as radionuclide purity, radiochemical purity, sterility, and pyrogenicity, as well as ensuring the radiopharmaceutical meets regulatory standards. According to the Canadian Nuclear Safety Commission (CSC), failure to comply with these standards can result in adverse patient reactions or ineffective diagnostic results. The sterility of radiopharmaceuticals is crucial regardless of the method of administration, not only for intravenous injection. A properly conducted quality control process ensures that the radiopharmaceutical is safe and effective for clinical use, aligning with guidelines provided by the Canadian Standards Association (CSA). Question 3. Which of the following best describes the principle of image reconstruction in SPECT and PET imaging? A. Both SPECT and PET rely on direct imaging without the need for computational reconstruction. B. SPECT imaging reconstructs 3D images from TWAD projection data using algorithms like filtered back projection. C. PET imaging requires a constant frame rate to obtain high-resolution images in any scenario. D. SPECT imaging uses computational models that require no patient-specific adjustments for accurate results. Answer. Correct answer. B. SPECT imaging reconstructs 3D images from TWAD projection data using algorithms like filtered back projection. Explanation. Image reconstruction in both SPECT and PET involves the process of converting TWAD data obtained from detectors into 3D images. For SPECT, single photon emission computed tomography, this typically involves techniques like filtered back projection (FBP) or iterative reconstruction to projection data and produce the final image. PET, positron emission tomography, uses a similar process but is based on detecting annihilation photons from positron-electron interactions, requiring different reconstruction algorithms. Proper understanding of these processes is critical for the accurate interpretation of nuclear medicine scans. The process of image reconstruction must account for various factors like detector sensitivity and resolution, which significantly affect the image quality and diagnostic utility. Question 4. Based on the information from current research, what are the primary concerns when managing adverse reactions to radiopharmaceuticals? A. Adverse reactions are minimal in patients who have previously been treated with radiopharmaceuticals. B. The primary concern is the possibility of allergic reactions and drug interactions, which must be identified before administration. C. Adverse reactions are only relevant to diagnostic procedures and are not a significant concern in therapeutic nuclear medicine. D. Adverse reactions are not influenced by the radiopharmaceuticals administered. Answer. Correct answer. B. The primary concern is the possibility of allergic reactions and drug interactions, which must be identified before administration. Explanation. Adverse reactions to radiopharmaceuticals can range from mild symptoms such as rash or nausea to severe reactions like anaphylaxis. Identifying allergies and potential drug interactions before administering radiopharmaceuticals is crucial for patient safety. The pharmacological therapeutic guidelines for nuclear medicine suggest that thorough patient history, including any allergies or current medications, should be reviewed before radiopharmaceutical administration. This can significantly reduce the risk of adverse reactions. While therapeutic procedures like iodine 131 therapy may have long-term effects, adverse reactions remain a concern in both diagnostic and therapeutic contexts. Ignoring dose effects, assuming prior treatments are always safe can lead to mismanagement of patient care. Question 5. The relationship between biodistribution and the design of radiopharmaceuticals is crucial for effective imaging. Which of the following factors does not significantly influence biodistribution? A. The chemical structure and lipophilicity of the radiopharmaceutical. B. The molecular weight of the radiopharmaceutical. C. The type of imaging equipment used during the procedure. D. The site of radiopharmaceutical administration, e.g., intravenous or oral. Answer. Correct answer. C. The type of imaging equipment used during the procedure. Explanation. Biodistribution refers to the distribution of a radiopharmaceutical within the body after administration. Factors such as the chemical structure, molecular weight, and the route of administration, e.g. intravenous versus oral, directly affect how the radiopharmaceutical is absorbed, distributed, metabolized, and excreted. The imaging equipment itself, e.g. gamma camera or PET scanner, does not influence the biodistribution of the radiopharmaceutical. It merely detects the emitted radiation. The chemical structure, particularly lipophilicity, influences the compound's ability to pass through biological membranes, while the molecular weight affects the compound's ability to localize in specific tissues. Understanding biodistribution is crucial for selecting the appropriate radiopharmaceutical for each imaging procedure. Question 6. Under the assumption that a nuclear medicine physician is conducting a thyroid scan using iodine 123, what key factor must be considered when evaluating image quality? A. The resolution of the camera is irrelevant to the quality of thyroid scans. B. The scan should only be evaluated based on the patient's size and not the imaging parameters. C. Sensitivity of the gamma camera plays a critical role in detecting low levels of radioactivity in small areas. D. Only the noise-to-signal ratio should be considered when assessing image quality. Answer. Correct answer. C. Sensitivity of the gamma camera plays a critical role in detecting low levels of radioactivity in small areas. Explanation. Image quality in nuclear medicine is influenced by several factors, including the sensitivity of the gamma camera, resolution, noise, and the patient size. Sensitivity refers to the ability of the camera to detect small amounts of radiation, which is particularly important when imaging small structures like the thumb. High sensitivity ensures that even faint emissions from the iodine 123 radiopharmaceutical are detected accurately, contributing to better image quality. The noise-to-signal ratio and resolution are also important, but are secondary to sensitivity when assessing the detectability of low-level radioactivity. Ensuring the gamma camera's sensitivity is calibrated is essential for high-quality imaging, as outlined in the quality guidelines from the Society of Nuclear Medicine and Molecular Imaging. Question 7. What would happen if a radiopharmaceutical with poor radionuclide purity were administered to a patient? A. It would have no effect on the imaging process or the patient's health. B. The image quality could be compromised and there may be an increased risk of adverse reactions. C. The radiopharmaceutical would not be absorbed by the target tissues, rendering the scan ineffective. D. The radiopharmaceutical would improve the scan's clarity due to enhanced radioactivity. Answer. Correct answer. B. The image quality could be compromised and there may be an increased risk of adverse reactions. Explanation. Radionuclide purity refers to the proportion of the radioactive isotope in the radiopharmaceutical that is in the desired form. Poor radionuclide purity can lead to unwanted radioactive isotopes in the preparation, which can cause unpredictable behavior in the body. This may affect image quality by creating signal-to-noise ratio or result in non-specific binding of the radiopharmaceutical to tissues, which complicates image interpretation. Additionally, impurities could lead to adverse reactions if other isotopes are more toxic or have different biological behaviors. As specified in the Canadian Pharmacopoeia and Nuclear Medicine Guidelines, radionuclide purity is critical for both diagnostic accuracy and patient safety. Question 8. In an effort to improve the accuracy of imaging in pediatric nuclear medicine, which consideration should be prioritized when selecting a radiopharmaceutical? A. Select the radiopharmaceutical with the longest half-life to ensure imaging accuracy. B. Consider the potential radiation dose and choose a radiopharmaceutical with a minimal effective dose. C. Choose radiopharmaceuticals based solely on their ability to provide the best imaging resolution. D. Pediatric patients are not typically considered in the radiopharmaceutical selection process. Answer. Correct answer. B. Consider the potential radiation dose and choose a radiopharmaceutical with a minimal effective dose. Explanation. Pediatric patients are more sensitive to radiation exposure and minimizing the radiation doses. The top priority in pediatric nuclear medicine, radiopharmaceuticals with shorter half-lives and lower radiation doses are preferred as they reduce the amount of radiation the child receives while still effective imaging. Additionally, radiation dose reduction strategies, including modifying the administered activity, should be employed to limit exposure. The Canadian Nuclear Safety Commission (CSC) guidelines emphasize the importance of considering the unique needs of pediatric patients in the radiopharmaceutical selection process to minimize the risk of long-term radiation effects. Question 9. In the context of image registration and fusion techniques in nuclear medicine, what is the primary concern when aligning functional PET images with anatomical CT images for oncology patients undergoing follow-up scans? A. Ensuring pixel resolution is matched to original patient weight. B. Guaranteeing isotropic voxel interpolation regardless of anatomical shifts. C. Counting for physiological changes and patient positioning variations between scans. D. Eliminating all scatter from the CT data to avoid misregistration artifacts. Answer. Correct answer. C. Accounting for physiological changes and patient positioning variations between scans. Explanation. Functional PET images must be fused accurately with anatomical CT data to provide spatial context. A critical challenge is variations in patient positioning or internal physiological changes, e.g., bowel gas or tumor shrinkage between scans. Misalignments can result in inaccurate localization of treatment targets. While scatter and resolution matter, registration precision is most impacted by inconsistent positioning and anatomy changes. This is addressed in CAMRT guidelines for oncology imaging and IA recommendations on hybrid imaging protocols. Question 10. Based on the information provided, which of the following factors is most likely to result in a falsely elevated ejection fraction measurement during a gated blood pool scan? A. Incorrect placement of regions of interest, ROIs, excluding the apex. B. Patient's elevated blood pressure at the time of scan. C. Cardiac arrhythmia during acquisition. D. Use of filter back projection for image reconstruction. Answer. Correct answer. A. Incorrect placement of regions of interest, ROIs excluding the apex. Explanation. Incorrect ROI placement that omits part of the left ventricle, particularly the apex, can significantly underestimate end diastolic volume, leading to an artificially elevated ejection fraction. Arrhythmias can cause inconsistent counts but typically lead to poor gating, not falsely high F. Filter back projection affects image noise, not accuracy directly. This concept is reinforced in MMI guidelines for cardiac blood pool imaging and CAMRT standards for quantitative nuclear medicine. Question 11. When evaluating the merits of radiopharmaceutical design for renal imaging, which characteristic is most desirable for accurate differential renal function assessment using 99 mag? A. High cortical retention and low glomerular filtration. B. Predominantly hepatobiliary excretion. C. High tubular extraction and minimal plasma protein binding. D. Slow clearance to prolong imaging window. Answer. Correct answer, C. High tubular extraction and minimal plasma protein binding. Explanation. 99 mag is used for renal tubular function assessment. The ideal tracer has high tubular extraction efficiency, low protein binding, and rapid clearance to optimize differential function evaluation. MAG's tubular secretion mirrors effective renal plasma flow better than glomerular agents like EPA. This aligns with ENUM Renal IM guidelines and Health Canada product monographs. Question 12. During the process of radiopharmaceutical preparation, what is the most significant risk when using multi-dose vials of 99 labeled compounds over several hours? A. Declining radiochemical purity due to radiolysis. B. Variation in molar activity leading to image noise. C. Cross-contamination from handling between patients. D. Insufficient photon yield from technetium decay. Answer. Correct answer, A. Declining radiochemical purity due to radiolysis. Explanation. Radiolysis can degrade the chemical integrity of radiopharmaceuticals, especially over time in multi-dose vials. This can lead to increased free pertinite and altered biodistribution, potentially mimicking pathology. Proper shielding, stabilizers, and UC mitigate this risk. This is outlined in Health Canada's GMP guidelines in US radiopharmaceutical preparation. Question 13. Istanwar, a 55-year-old male undergoing 18-FD GPECT for suspected lymphoma recurrence, is found to have intense uptake in the mediastinum and mild bilateral hilar activity. He also reports recent flu-like symptoms. What is the most appropriate interpretation of this scan? A. Likely recurrence of lymphoma requiring biopsy. B. Normal post-treatment change. C. Reactive lymphadenopathy secondary to infection. D. Artifact due to respiratory motion. Answer. Correct answer, C. Reactive lymphadenopathy secondary to infection. Explanation. 18FG is taken up by inflammatory and infectious processes as well as malignancy. Given Ista Anwar's recent flu symptoms and bilateral symmetric hilar and mediastinal uptake, this pattern is more consistent with reactive lymphadenopathy rather than recurrent lymphoma. This differentiation is emphasized in MMI and ENA Oncologic PET Interpretation Guide. Question 14. As evidenced by radiation safety standards, which of the following best exemplifies adherence to the ALARA principle in daily nuclear medicine practice? A. Performing dose-calibrated checks once every 6 months. B. Wearing a dosimeter only during therapeutic administrations. C. Maintaining at least 2 meters from the patient during radiopharmaceutical injection whenever possible. D. Relying on verbal communication to avoid unnecessary written protocols. Answer. Correct answer, C. Maintaining at least 2 meters from the patient during radiopharmaceutical injection whenever possible. Explanation. ALARA, as low as reasonably achievable, emphasizes time, distance, and shielding. Maximizing distance is one of the most effective means to reduce exposure. Standing 2 meters away during and after injection limits occupational dose. Regulatory bodies like CSC and IA Radiation Protections reinforce these operational best practices. Question 15. During a SPECT acquisition using a dual-head gamma camera, what artifact is most likely to occur if one detector experiences a collimator shift mid-study without software correction? A. Ring artifact. B. Edge packing artifact. C. Misregistration artifact. D. Truncation artifact. Answer. Correct answer, B. Edge packing artifact. Explanation. A collimator shift during acquisition, especially if uncorrected, results in edge packing where counts are improperly concentrated at image peripheries. This is a hardware-induced artifact and must be recognized during routine quality control checks. Refer to CAMRT and vendor-specific QC protocols for gamma camera performance integrity. Question 16. Contrary to popular belief, which of the following is not a valid reason for poor radiopharmaceutical uptake in bone scintigraphy using 99 CAMRT? A. Overhydration prior to injection. B. Renal failure reducing tracer clearance. C. Bisphosphonate therapy prior to the scan. D. Excess aluminum in the eluted generator. Answer. Correct answer A. Overhydration prior to injection. Explanation. While hydration improves image quality by increasing background clearance, it does not reduce bone uptake. In contrast, bisphosphonates and aluminum contamination can interfere with MDP binding to hydroxyapatite. A renal failure prolongs blood pool activity. This is detailed in MMI bone scintigraphy guidelines and ERSP. Question 17. Mrs. Campos is undergoing a therapeutic I-131 treatment for thyroid cancer ablation. She has a toddler at home. What should the nuclear medicine technologist prioritize when discharging her post-therapy? A. Instruct her to remain in a lead-lined room at home. B. Advise her to discontinue breastfeeding and avoid close contact with her child. C. Suggest the child be given potassium iodide to prevent thyroid uptake. D. Recommend using oral gloves during feeding. Answer. Correct answer. B. Advise her to discontinue breastfeeding and avoid close contact with her child. Explanation. I-131 is excreted in breast milk and poses significant radiation risk to children via both internal and external exposure. Health Canada and CSC guidelines require strict post-therapy instructions, including cessation of breastfeeding and limiting contact with young children for a specified period, typically 7 days, depending on the administered dose. Question 18. Through careful analysis of quantitative PET imaging, which metric is most susceptible to inaccuracies due to improper attenuation correction? A. Standardized uptake value, SUV. B. Ejection fraction. C. Time activity curve, TAC. D. Effective half-life. Answer. Correct answer A. Standardized uptake value, SUV. Explanation. SUV calculations depend heavily on accurate attenuation correction. Any mismatch between CT attenuation map and PET data due to motion, artifacts, or metal implants can skew SUV, which affects interpretation of tumor metabolism. This issue is covered in ENM PET performance standards and MMI documentation on quantitative imaging integrity. Question 19. A nuclear medicine technologist notices a linear area of increased activity along the patient's arm during 99 CAMRT bone scan. What is the most probable cause of this finding? A. Intravenous injection infiltration. B. Osteomyelitis of the humerus. C. Referred uptake due to muscular strain. D. Metal artifact from prior surgical pin. Answer. Correct answer A. Intravenous injection infiltration. Explanation. A linear area of increased activity along the arm is classic for radiopharmaceutical infiltration at the injection site, leading to soft tissue retention of the tracer. Osteomyelitis or strain would localize differently, and metal artifacts don't cause linear uptake. This is detailed in MMI and CAMRT quality assurance materials. Question 20. A patient undergoing a thyroid uptake test using 123 is inadvertently given a recent contrast-enhanced CT. How might this affect the scan? A. Uptake will be falsely elevated due to competitive binding. B. Uptake will be diminished due to iodine saturation from the contrast. C. The contrast agent improves the visualization of thyroid lobes. D. The scan cannot be affected because iodine contrast and radioiodine act differently. Answer. Correct answer B. Uptake will be diminished due to iodine saturation from the contrast. Explanation. Iodinated contrast can saturate the thyroid with stable iodine, blocking uptake of radioactive iodine, leading to false low uptake results. A waiting period of 6-8 weeks is often required before thyroid imaging post-contrast. Refer to ACA guidelines and MMI practice standards. Question 21. Which of the following scenarios most appropriately demonstrates a violation of radiation safety principles in a nuclear medicine department? A. Using tongs and lead shielding while handling high-activity vials. B. Wearing a ring dosimeter beneath surgical gloves. C. Transporting radiopharmaceuticals in a secure labeled lead container. D. Keeping therapeutic doses in a designated locked lead line storage area. Answer. Correct answer. B. Wearing a ring dosimeter beneath surgical gloves. Explanation. Ring dosimeters should be worn outside gloves directly on the skin to accurately measure extremity exposure. Wearing them beneath gloves can compromise monitoring, violating ALORA principles. This is addressed in CSC compliance guidelines and CAMRT radiation protection training. Question 22. When performing ventilation imaging with 99 TTA aerosol, what factor most significantly affects image quality and patient safety? A. Use of a wet nebulizer to reduce particle concentration. B. Ensuring minimal breathing effort to limit aerosol dispersion. C. Proper filtering and containment of exhaled radioactive particles. D. Ventilation imaging performed prior to perfusion imaging. Answer. Correct answer. C. Proper filtering and containment of exhaled radioactive particles. Explanation. To protect staff and the environment, aerosol particles must be trapped using filters in the ventilation apparatus. Without proper filtration, radioactive contamination and airborne spread are likely. This is critical per Health Canada and IA radiological protection guidelines. Question 23. What is the main purpose of using a smoothing filter during the reconstruction of SPECT images? A. To reduce scan time. B. To increase photon count. C. To reduce image noise and improve interpretability. D. To correct for patient motion. Answer. Correct answer. C. To reduce the image noise and improve interpretability. Explanation. Smoothing filters e.g. Butterworth, Gaussian are applied during SPECT image reconstruction to reduce statistical noise, making images more readable without significantly compromising resolution. They are not used for motion correction or count increases. This is a standard covered in SPECT UC protocols and vendor-specific manuals. Question 24. A referring physician requests a bone scan for a patient with a suspected stress fracture. The scan is negative. What should be the technologist's most appropriate action? A. Repeat the scan immediately with a higher dose. B. Proceed with a whole-body PET. C. Document and report the findings. Stress fractures may not appear in early scans. D. Tell the patient that no injury is present. Answer. Correct answer. C. Document and report the findings. Stress fractures may not appear in early scans. Explanation. Early stress fractures may not yet show radiotracer uptake due to limited osteoblastic activity in early phases. Technologists should not offer diagnoses but should note limitations, allowing clinicians to correlate with clinical and other imaging findings. Refer to CAMRT scope of practice and MMI musculoskeletal protocol. Question 25. Which of the following best explains why AT12 is ideal for myocardial perfusion PET imaging? A. Long half-life enables prolonged image acquisition. B. Beta-minus emissions enhance myocardial uptake. C. Generator produced with ultra-short half-life allowing rapid sequential imaging. D. Requires no attenuation correction due to high photon energy. Answer. Correct answer. C. Generator produced with ultra-short half-life allowing rapid sequential imaging. Explanation. AT12 is generator produced with a 75-second half-life, making it suitable for rapid dynamic cardiac imaging and minimizing radiation dose. Its use supports stress rest protocols within minutes. This is highlighted in MI and in cardiovascular PET imaging guidelines. Question 26. During a myocardial perfusion SPECT scan, the patient experiences significant motion between projections. What artifact is most likely to resolve? A. Horizontal elongation of the heart. B. Reversible defect in the inferior wall. C. Gated wall thickening artifact. D. False perfusion defect resembling ischemia. Answer. Correct answer. D. False perfusion defect resembling ischemia. Explanation. Patient motion introduces inconsistencies across projections, leading to false perfusion defects often misinterpreted as ischemia. Motion correction software or requisition is often necessary. This issue is well documented in SPECT-UC standards and ACA nuclear cardiology guidelines. Question 27. Technologist prepares a radiopharmaceutical dose and records the wrong patient ID on the syringe shield. What is the immediate best course of action? A. Continue with administration since dose is correct. B. Notify the supervisor and follow incident reporting protocol. C. Replace the syringe shield without documenting. D. Discard the dose without informing anyone. Answer. Correct answer. B. Notify the supervisor and follow incident reporting protocol. Explanation. Even if the dose is correct, mislabeling presents a serious patient safety risk. Proper incident reporting, including documentation and supervisor notification, ensures traceability and regulatory compliance. Refer to CSE reporting standards and CAMRT professional practice policies. Question 20. What is the rationale for performing quality control on dose calibrators using a long-lived sealed source such as CS137? A. To check for volume-dependent errors. B. To verify activity accuracy over different energies. C. To assess constancy over time using a stable reference. D. To simulate patient imaging conditions. Answer. Correct answer. C. To assess constancy over time using a stable reference. Explanation. Constancy checks are done daily using long-lived standards, e.g. CS137, to ensure the dose calibrator consistently measures a known activity. This is required per Health Canada and EUC protocols confirming the calibrator's stability and reliability. Question 29. During a SPECT-TT scan for parathyroid localization using 99 CertMedbry, the CT portion reveals a small lesion posterior to the thyroid lobe, but the SPECT shows no corresponding uptake. What is the most appropriate interpretation? A. The lesion is like it, a parathyroid adenoma with suppressed tracer uptake. B. The CT finding is incidental and the lack of uptake suggests it's non-functional. C. The SPECT scan must be repeated with different collimator. D. The lesion is definitively parathyroid adenoma and surgery should proceed. Answer. Correct answer. B. The CT finding is incidental and the lack of uptake suggests it's non-functional. Explanation. When anatomic CT findings do not match functional tracer uptake, this often suggests an incidental, non-functional lesion such as cyst or lymph node. Functional imaging SPECT is critical in identifying active parathyroid adenomas, and lack of uptake reduces suspicion. This approach is supported in MMI and EAM parathyroid imaging guidelines. Question 30. A technologist is preparing a radiopharmaceutical kit and notes the expiration of the iluate from the 99 generator occurred 8 hours ago. What is the correct action? A. Use the iluate if there is still adequate activity. B. Proceed but record a warning in the QC log. C. Discard the iluate and elute a fresh dose per protocol. D. Add extra saline to dilute the expired iluate for safety. Answer. Correct answer. C. Discard the iluate and elute a fresh dose per protocol. Explanation. Using an expired iluate violates aseptic and safety standards. Even if radioactivity remains sufficient, chemical purity and sterility may no longer be guaranteed. Best practice is to elute fresh 99 per kit preparation protocols and regulatory guidance, e.g. Health Canada SPSC standard